Hello friends in Anatomy and Physiology class. This is Hassan Nafid, your Anatomy and Physiology instructor at Madison College in Wisconsin. Tonight we're going to talk about the heart. The heart is a muscular organ that exists in the thoracic cavity. The heart is a muscular pump, actually, that pumps blood to the circulation. It pumps blood to the whole body. This is known as the systemic circulation. It also pumps blood to the lungs to be loaded with oxygen, and this is known as the pulmonary circulation. The heart also supplies blood to the brain, and this is known as the cerebral circulation. The heart has to supply its own muscles with blood, and this is known as the coronary circulation. If you take a look at the heart, I'm going to show you the heart here. This is known as the heart of America. The heart is found in the thoracic cavity. It is located central, but it's deviated to the left. So this is the position of the heart. Right? Central, but deviated to the left. So it's not on the left side of the chest. It is central, but it's deviated to the left side of the body. The heart is as the size of the fist. The heart is one of the organs, actually one of the important organs of the cardiovascular system. Let's take a look at the heart and examine its part. The heart actually is two pumps that are connected together, right heart and left heart. They are separated by a septum or valve. This is known as the interventricular septum. So this is the right heart. This is the left heart. And they are separated by the interventricular septum. The heart has four chambers. Taking a look at it, right heart has the right atrium and right ventricle. It also on the other side has left ventricle, left atrium, and left ventricle. The atria and the ventricles are connected like in the left and in the right, and they are separated by a valve. This is the valve here. The prop is passing through the valve. On the right side, they are separated by the tricuspid valve. This is a tricuspid valve right here. The tricuspid valve separates the right and left ventricle, while the mitral valve in the other side separates the left atrium and left ventricle. This is also known as the bicuspid valve. So four chambers, two atria, two ventricles, two inner valves, tricuspid and mitral. There is also two other valves that separates the heart or controls the blood flow in the major arteries, and these are the pulmonary valve and the aortic valve. It's a little hard to see from here, the pulmonary and the aortic valve. Pulmonary valve controls blood flow to the pulmonary trunk, and aortic valve controls blood flow to the aorta. The aorta is one of the major, actually the major blood vessel or the major artery that exists in the body, and actually it is the largest artery that exists in the body. Closing back the heart chambers, I'm going to show you the exterior from outside. As we said, this is the right auricle. This is the right atrium. The cavity of the right atrium is kind of interesting. The cavity of the right, or the chamber of the right atrium, interesting. It does have openings for the superior inferior vena cava that drains blood from the lower part. Inferior vena cava drains blood from the lower part of the body. When we say lower part, we talk about body parts that are below the diaphragm, while the superior vena cava with its two branches here, the brachiocephalic veins, drains blood from the upper part of the body. And here we're talking about body parts that are above the diaphragm, and they both drain into the right atrium. So right atrium receives blood that is exhausted, oxygen poor, and we can say carbon dioxide rich, that drains into the right atrium. From the right atrium goes to the right ventricle through the tricuspid valve. On the other side, the left atrium receives blood that is oxygen rich from the lungs, and this comes to the right atrium by the pulmonary veins. These are the two pulmonary veins. Let's take a look at the major vessels of the body. These are found at the base of the heart. This is known at the base of the heart, while this is known at the apex of the heart. And as we said, the apex of the heart is the lowermost, outermost area of the heart that heart contraction can reach. The apex of the heart is pointing to the left hip. It always points to the left hip. Apex of the heart actually is found in the normal person at the intersection of the line that's drawn from the mid-clavicle down and meets the line that is drawn horizontal at the level of the sixth intercostal space. That's the location of the apical pulse. Let's take a look at the aorta. If you look at the aorta here, the aorta has its three branches. This is the ascending aorta. This is the aortic arch, and this is the descending aorta. If you see here, it goes down. The descending aorta becomes the thoracic aorta, and eventually it becomes the abdominal aorta. Branches of the aorta are here from right to left. This is the brachiocephalic artery. Left common carotid in the middle, and left subclavian in the far left. These are the branches of the aorta. Blood supply to the heart comes from the coronary arteries. Coronaries emerge also or comes out of the aorta. We have two major coronary arteries. Right coronary, I'm going to take this away so you can look at it. Right coronary artery that runs between the right atrium and that sulcus or groove or depression, right atrium and right ventricle. It runs here and it divides into its branches. These are known as the marginal branches. So marginal branches are branches of the right coronary artery, and it also gives the posterior interventricular coronary artery. And this is the artery that runs between the two ventricles. And the other side, if we turn the heart to look at its left side, we will also find the left coronary artery here runs also. Let me open the auricle. But actually, that way here. It runs on the sulcus between the left auricle and the left ventricle. This is the left coronary artery. Left coronary artery gives two branches. One of them is an important branch known as the anterior interventricular coronary artery. Anterior interventricular coronary artery. This is supply the front and most of the anterior part of the heart muscles or the myocardium. It also gives a branch that turns and winds in the back. This is the front like that. So it gives this branch, and this branch is known as the circumflex coronary artery. These arteries are dead-end arteries with poor anastomosis, so blockage of these arteries can result in what is known as ischemic heart disease or chest pain, or we call it angina pectoris, and it can be really serious, and it might need reopening on what we call angiography or angioplasty, which means reopening of these arteries by some surgical procedures. In the back here, there is a big vein that drains the heart. This is the coronary sinus, and the coronary sinus is the largest vein in the heart. There is also the great cardiac vein. The coronary sinus also opens and drains just like any other arteries, like the superior vena cava, inferior vena cava. It drains its blood back to the right atrium in the coronary opening of the coronary sinus here. The right atrium also an interesting area where you find the sinoatrial node, and this is the pacemaker of the heart. Talking about the layers of the heart has three layers. The outer layer is known as the epicardium, the muscular layer of the heart is known as the myocardium, and the inner lining of the heart is known as the endocardium. I want to show you inside the heart here in the endocardium, one of the interior chamber of the heart, there is a muscular part. This is known as the papillary muscles. The papillary muscles are the muscle of the heart, and these are the coronary tendinae, and the coronary tendinae are the tendons that holds down these valves and anchor the valves to the wall of the heart, or the walls of the papillary muscles. Thank you for watching this video, and I'll see you in another video in one of our anatomy sessions.